Everything looks great. How do you feel?
I feel good.
Yes? Any pain at all? Any pain at all?
No.
Oh, lovely. You ready to go back to Jamaica? Yes? So for doctors watching, this is day 1 of the ref deck technique that I do. Ref deck is the refractive aspect of a modified, extremely thin desec techniques that I do in these cases. Surgery takes minutes. Basically, you can do these topical without stitches. We enter through an incision that I do a shelved incision in these cases, even if she's had cataract surgery elsewhere, like in her case. You can see me putting in the graft here of 8 millimeters, centering it perfect to her optical center of the cornea and the lens. And most important is the fact of not taking stitches so you don't induce stigmatism. Don't take long to do the surgery so you don't damage the endothelium of the graft that's there, the very thin desec graft. Here you can see the air bubble on day 1. I have an inferior iridectomy, which is partial. They say they don't have transillumination defects or look ugly. You have a nice, right here at 6 o'clock, I have an inferior partial iridectomy, all right? Now, why is it refractive? 1, you're going in neutral. 2nd, you're not inducing astigmatism with stitches. And 3rd, when I make the relaxing or the astigmatic incisions, you know, the incisions I make in between the graft here, after the graft is in place and nicely stuck with the air bubble to release excess fluid in the interface between the donor cornea and the recipient, that incision, I make it exactly topographically and refractively on the steep axis. So we're also correcting her existing astigmatism and bring them straight to neutrality or refractive emmetropia, even in cases like this. So this is important to understand the concept of corneoplastique is how we refractively address even pathological anatomical abnormalities. So you can see here very deep cuts. If you can see this 1 and 2 at 5 degrees axis I have made, which are actually relaxing for the fluid. You may come up front and show it a little better. You can see how deep these are and precisely of the size of my personal nomogram that I use for astigmatism. And if you see the topography of this patient, you can see right there the 5 degree axis with the steepness in this distorted cornea with high loss of endothelium, which causes the cornea to be much thicker, right? And similarly, you can see it on the Penacami XL wave again, 5 degree axis. We have gone and made the relaxing incision right there to take care of her stigmatism while operating. How do you feel? Day 1. Yes?
I feel fine.
Here we go. Have fun, then after this I'll let you have some coconut rum in Jamaica.